University of Ottawa. Raywat, thanks so much for joining us.
It's my pleasure. Thanks for having me.
And I know it's early, so that I definitely owe you a shot or something at a more appropriate time. But when we're looking at we're looking at the holiday season. There's more gatherings coming. We've been hearing about, how hospitals are overwhelmed right now. Just with the anticipated gatherings over the next week, do you anticipate that this is going to get at least a bit worse before it gets better?
Yeah, I think that's pretty obvious. If you look across the country, what's happening, we see the test positivity rate of influenza has come down in the pediatric population for the first time nationally. That doesn't mean it's happening locally. In fact, in Ottawa, the wastewater signals suggest that influenza and RSV and COVID are still climbing. So as people go indoors, and now that we have no mask mandates and no one seems to care about curtailing their exposures to any extent, I anticipate some increased levels of transmission, yes.
And I want to get to a little bit more on some of the I guess, conversations we've been having surrounding mandates, but just this idea of, influenza, RSV, and COVID-19. We've been hearing a lot about COVID the last 2 years, but is there any reason you can see as an epidemiologist of just why we're seeing an uptick in some other respiratory viruses this year as well?
Yeah, that's a loaded question, and it's very controversial. A lot of debate is happening right now, and there is a lot of misinformation as well. Some people are suggesting that all this mask wearing has impaired our immune system's ability to fight off infection, which to my mind is nonsensical because we're seeing the same issues in places that had no mask wearing. Sweden, Oklahoma, Florida, all the red states, right? So if that was the case, you would think that those places would be fine. The places that are fine are places like Japan that has pretty strong mask wearing still. So another possibility is that COVID infection has impaired the immune systems of some people who've become infected. Again, this is a controversial theory. I'm not an immunologist. I can't offer it any weight, but this is being discussed with some vigor amongst the experts. And if that's the case, then it would explain why a large number of children in particular who were infected, many of them asymptomatically, may be experiencing some extent of immune injury. I was reading a study just the other day about how 90% of American kids might have been infected with COVID this past couple of years. If that's the case, that would explain some of this. But again, don't take that to the bank. I don't know. This is controversial, and we're still trying to figure it out.
I've already got my wallet open, so I'm a little late. Yeah, no, and that's why I wanted to ask, because there is a lot of misinformation out there. So even just to get an idea of what experts are even saying right now is, I think, important for people to kind of understand. And just on that similar aspect, when we talk about being infected with COVID, I guess there's still a lot for us to learn about the effects of long COVID.
That's right. I will add, before I move on to that topic, that the RSV wave right now, the test positivity rate this year is less than last year. So we have fewer cases this year than last year. It's just that the cases this year are for some reason more severe. And that might be because of immune injury. It might be because of something else. I don't know. But long COVID, you're right. Long COVID is another great mystery here. And there's new data coming out all the time. A recent study suggests that those suffering from long COVID might have a surfeit of microclots around their body. That's a possibility. And there seems to be a correlation between the severity of your COVID infection and whether or not you experience long COVID. So it's worthwhile getting vaccinated to reduce the likelihood that when you do become infected, you would have a severe infection.
And I guess you mentioned get vaccinated. That is the main suggestion from all the experts right now, right? Is get your flu shot and get up to date on your COVID booster.
Definitely with flu, get your flu shot. There is no RSV vaccine yet. There will be next season, knock on wood. With COVID, yeah, get up to date. As I say, get vaxxed to the max. But that's not going to be enough to prevent the transmission of COVID, as we know, given the new immune evasive variants. It'll help a little bit, but not entirely. I'm a fan right now of masking in public indoor settings. Because we still have vulnerable people to protect, and we still don't know about the immune injury aspects that might result from infection. So we have it in our power to reduce the likelihood of infection. We should use it when we can, despite the lax guidance from the government.
Yeah, and this is what I wanted to kind of turn our attention to right now. We are seeing, hospitals are facing incredible amounts of pressure right now. And even it's happening across the country, too. Alberta's Pediatric Hospital in Calgary there, they have a waiting room that's set up in a trailer out in the parking lot. CHEO has a second intensive care unit. opened as well. I guess when it comes to the hospital kind of settings that we're dealing in these right now, also coming off of 2 years of COVID, I guess have we taken our foot off the gas in terms of trying to protect that hospital capacity? Because remember, this is why we did all those shutdowns, right? This is why we did everything, was to protect hospital capacity, and it seems like that's now not an issue for the government.
Yeah, you're right. Something strange is happening psychologically amongst our leaders and amongst the country as a whole, frankly. I'm not sure where this comes from. I think there is a sense that, hey, I've got my doses, therefore my likelihood of dying is now minimal, therefore I don't care about anybody else. There's a staggering amount of selfishness implicit in all of this. And also a lot of just simply people not knowing what the crisis in the hospital is. I have faith that most people, if they knew how bad it is, would probably be a little more alarmed and would be eager to protect the system, especially given that right now it's our youngest, it's our children who are at greatest risk. We stop the world for the elderly. We should be able to do something for the very young.
And I guess we don't have a crystal ball, but given what we've been talking about, just in terms of we don't know a lot about long COVID, or I guess are we putting kids at risk here for some longer term damage by not fixing some of the more acute issues here in the short term?
We might be, absolutely we might be. I don't know if that's true or not. No one knows for sure, but it strikes me that the wise thing to do is to err on the side of caution and try to prevent kids from being infected if we can. The larger healthcare issue is one of capacity, and we've been struggling with this for many years, even before COVID. But we can't fix that in a matter of weeks. Right? This is a supply and demand issue. Insufficient healthcare supply for rising healthcare demand. The supply issue we will have to fix at a political level in the coming years and decades. The demand issue we can address right now with individual behaviors.
You mentioned kind of the psychology of us and leaders, and I think that kind of plays a part in it. But we've talked a lot about, mandates. There's been some big emotional fights about whether or not there should be mandates in schools and other settings as well. But do you think that, a mandate would help in a sense of it kind of forces people to wear a mask instead of giving them the option, which, it looks like, not everybody's not doing it, but it looks like, a lot of us aren't wearing masks.
This is a cultural issue. If you look at societies like Japan, where there is no mandate, and yet everyone wears a mask anyway. So there's a decision made at the individual and societal level to do what's necessary. And part of that has to do with trust in the leadership to give appropriate information that is not peppered with misinformation that is ideologically driven. We haven't got that advantage. We have a lot of misinformation and disinformation. We have ideological information merchants who are muddying the conversation. So I think it's probably impossible, frankly, to enforce a mask mandate now without a lot of societal upheaval. But yeah, I think a stronger messaging from the leadership would be nice. It would be nice if our chief medical officer wasn't seen partying without a mask in very crowded settings. It would be nice if the messaging wasn't, hey, you've got your vaccine, you're fine. You're probably not fine, frankly, because you're still a vector for transmission to other places, and you still have a chance of ending up in the hospital, however small that chance is, when the hospital capacity is small. I do want to add that's the big confounder here. Like, I understand people wanting to take more risks if there was capacity to treat you if you get sick, but there isn't capacity. Right? So that's the part of the equation that's missing in the narrative.
Yeah, and we see how it's all kind of rolled into one in that aspect. You did mention, just I'm kind of curious, in places like Japan, I know South Korea, Vietnam, places like that had, been popular in wearing masks before during flu season. Is that, it seems more like a culture of thinking of others. Are we just kind of lacking on that front?
Yeah, I wasn't going to say it outright, but I think you're right. And part of this too is the fundamental ethic upon which Western societies are based. We are individualistic societies, and that's part of the strength and wealth of our society, but it's also our Achilles heel. We tend not to sacrifice for the greater good. We tend to celebrate individual achievement, which has its virtues, but in a public health context, it can be a failure.
Sounds like a fantastic TED Talk we have to have. Ray, we'll leave it there. Thank you so much for your time on a Saturday morning. I appreciate it.
It's my pleasure. Thank you.